Welcome, 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 welcome. Welcome to Dolani's Corner. My name is Dolani Ajanaku and I am a medical doctor, MD, also in psychiatry training, hence why I love mental health and everything about it. If you're new here, please refer to the introductory video for more intricate detail as to who am I, what are we talking about here, and why does this matter? Is this even the right place for you to be, right? And to my returning viewers, welcome back, of course. I enjoy having you guys here with me. Today we're going to really start the journey of finding care. I started off by describing what mental health is, what mental health awareness should be, symptoms that would make you a little bit more concerned about possibly having anxiety disorders, and some people you identified with maybe general anxiety, maybe you identified with some social anxiety, you identified with having some phobias and you are interested in finding care, or you're aware that something is a little bit off and you would like to talk to someone and you're now open and you're accepting to finding this care. And the next question is, where do I find it? How do I get there? And what to look out for? And then when you start the journey of actually going through these websites or calling these professionals, you start to realize that they have a lot of letters after their names and you have no clue what it means. You're not alone. You are not alone at all. So I'm gonna make this pretty short and simple. I'm not gonna go and dive into too many intricate details as to how do you become a counselor, how do you become a therapist. I'm just going to give you the surface level. First, before I do that though, I am a medical provider, but I'm not your own medical health care provider. And that's why I love this series, because then it allows me to give you all this information so that you'll be able to find an appropriate mental health care provider for yourself. And secondly, being that every state is different, the legality surrounding how do you know, what qualifies as a counselor and a therapist is going to be different sometimes in different states. And then also in the next couple of years, there are going to be things that may change as well. So take this with a grain of salt. All right. So we're going to start off by basically just talking about a counselor versus a therapist. A lot overlaps between these two. You would notice that a lot of times there are actually some therapists that say that they're doing counseling. A lot of people would prefer to say that they're going to counseling as opposed to saying that they're going to therapy sessions, because for some it has less stigma, so they feel more comfortable saying that they're going to a counselor. Either ways, there is a lot of treatment overlap as to what they can do. Both require a master's level of education, which means that they both got their bachelor's and they then decided to move forward and do an additional 2 to 3 years or so to get their master's degree. So these people, they know what they're doing. Okay, so I believe them. I'm okay, like, you know, go to a licensed counselor, go to a licensed therapist. They know what they're doing. And then you have the psychologists, and these are people who went beyond a master's degree, right? So they got their bachelor's degree and to become a psychologist, you have to get a doctorate degree. So these are people with PhDs or a PsyD, and to get a doctorate degree is usually an additional, on average, 5 to 7 years after getting a bachelor's to, you know, do this entire process. So this is a lot of years that people are putting in. So if I spent 5 to 7 years studying something, I have better knowledge of it than maybe somebody that spent 2 to 3 years doing it. Does that mean that you can only use a psychologist versus a therapist? No. You can get a therapist that works well for you as well. And there's some awesome psychologists out there. Either ways, I've worked with both. Both are lovely to work with. Both have great skills. And honestly, sometimes it's not even the degree, it's just the people, the person, right? So that's the good part of therapy. And I always say to people, sometimes it's not the degree, it's the person in front of you. Therapy itself is great. Finding the right therapist is the best thing. It's the more important thing. Moving forward, we're going to talk about basically more of the people that could provide therapy, but they can also provide medication, and those are psychiatrists, us. These are people that go to medical school, meaning that I did graduate from medical school. So I did my bachelor's degree, that's 4 years, and then we move forward to do a medical degree, which is another 4 years of medical school generally. And in between, you actually have people that got a master's degree before they went to medical school. So that's even more years. And then after medical school, we also do another additional 4 years of training and residency. I'm in my 3rd year currently. And that's even more training. And then after residency, you're allowed to, you know, pursue a fellowship if you really wanted to. So these are people that want to subspecialize in maybe addiction, in maybe geriatrics, forensics, child and adolescent psychiatry. That's even more years. So in total, that puts you to about 4, that's at least 12 years of training, and then maybe an additional 1 or 2 years. So that's between 12 to 14 years after high school at minimum. So it's a lot. So these are people that are dedicated to the art, trust me. And we have thousands and thousands and thousands of clinical hours. There's exposure to, obviously, it's not just the mental health perspective. We do have an understanding to a certain extent of internal medicine. We get like the full body because we went to medical school and you learned the full anatomy, full physiology, and other parts of human care. And then you have the nurse practitioners, and these are people with RNs. So the difference between a person that has a doctorate degree in nurse practitioner and a medical doctor, which is the MD, which is a psychiatrist, is that one is a nurse and one went to medical school. Both can call themselves doctors, but one is a medical doctor, which is the psychiatrist, and one is a doctor of nurse practitioner. So they're nurse practitioners. But a doctorate degree is the highest degree that you can obviously always go. So for nurse practitioners, these are people that spent the years, they put in the hard work to get an RN, and then they further their studies. There's some that would get a master's degree first and then go back to even get a doctorate degree in nurse practitioner. So you do understand at this point that these are people that are dedicated to providing the best care and the best level of care that they possibly can within their fields. To be a nurse practitioner, you do need at least a master's degree, and these are people that go through exams, they go through clinical rotations, they also have hours of clinical hours as well, and they are really dedicated to their art. So these are people that are also able to provide medication. All right, so it's very, very simple. If you're looking for someone to just talk to, that's your counselor, that's your therapist. If talking to someone has not really helped you with your symptoms and you're still feeling like it's not helping, it may be time to consider medications. Once you start considering medications, think about your nurse practitioner, think about which are the FNPs sometimes, the PMHNPs, right? So these are your nurse practitioners that are able to provide psychiatric care. I would say lean more towards the ones that have the PMHNP, because these are the people that they specialize predominantly in psychiatric mental health. And then also your psychiatrists, these are the people that all they do is psychiatry, right? They're medical doctors that are that went into psychiatry training. And then you can also ask your primary care physician if they're willing to prescribe psychiatric medications for you. Some are comfortable with it, some are not. You just have to ask them, talk to them about it, and then they'll be able to try to help you navigate basically where to go. So it really falls into two places: medications, no medications. If medications, find your psychiatrist, find your PMHNP, which is your psychiatry mental health nurse practitioner. And for some people, it's going to be their FNP, which is your family nurse practitioners that do sometimes provide psychiatric medications. In terms of training, in terms of specialization, it goes psychiatrist, the medical doctors who went to medical school, went to residency, and then it goes to PMHNP, and then you can try the family nurse practitioner. And if you can't find these, I would definitely obviously also suggest go to your primary care physician, see how comfortable they are in assessing people with assessing for psychiatric disorders, and how comfortable are they with prescribing medications. If they're not that comfortable with it, they'll just probably try to refer you, okay? And then for the no medication but want someone to talk to, it's your counselors, it's your therapist, so it's your psychologist, right? So I hope that makes it pretty simple. Thank you so much for tuning in. So the next time we're going to talk about how do we actually find these people? Where do we go? Okay. All right. Thank you, thank you, thank you. If you find this helpful, please feel free to like it, subscribe to the channel, and share it and to see, hey, other people may also find it helpful too. I really appreciate you tuning in. Thank you.